My name's Della. Life before Osteoid Osteoma, I was playing volleyball. I just started my first part-time job, so I was pretty busy, pretty focused. I had pain on my lower femur, and they said the pain would go away in about 3 to 4 months, and the pain didn't go away. Right after school, after I'd been walking on it a lot, or right after I'd been playing sports, it would start hurting, so I would have to lie down and rest it. And then I noticed that the pain started occurring at night. It started waking me up in the middle of the night, and that started happening more frequently.
Osteoid osteoma is a benign growth on the bones of the body. It often occurs in the long bones of the legs. And these are very benign lesions, but they're extremely painful because they secrete a substance called prostaglandin, which triggers the pain-sensitive fibers of the nerves.
I was so desperate to just be relieved from the pain that I was pretty well ready to do anything.
Osteoid osteomas, to be treated, need to be removed or destroyed. And there are several different ways of doing this. In the past, open surgery or using a laser wire that's inserted through a drill hole in the bone is the way this has been done in the past. I think focused ultrasound has many promising applications, and I think we're just beginning to scratch the surface. With focused ultrasound, you can go through the skin without having to make any incisions whatsoever.
This is really a new type of treatment modality. It's really the evolution of osteoid osteoma treatment.
Right now it's the morning of the treatment, and at this point I'm feeling anxious, hopeful to get it over with, ready to just move on with my life. There were a lot of people in a small room with me, but they all had their part in explaining what their job was there, and that made me feel better that there were so many people involved that I could go to if I had any questions regarding anything that was happening with the procedure. After about 4 days, once the procedure was finished, there seemed to be no pain. The pain went away completely, and I felt like I did before any of this had ever happened.
It's really good to be able to see a patient who comes in, young, healthy, vibrant, has this tumor that's causing them a lot of pain. You do one focused treatment, and they're up and they're kind of on their way again.
I definitely would recommend focused ultrasound to others, especially those who are young like me, who have so much of their life ahead of them. The recovery time is so short. The results have been amazing. It'll be nice just to be a normal teenager again.